This is CBC Compass.
This is Tuesday, March 17th. Here's what's happening now on Prince Edward Island. Fresh guidance tonight from PEI's Chief Public Health Officer. Bars on PEI are now closed. Only takeout is allowed from island restaurants. And new measures will be taken at island hospitals to make room for potential COVID-19 patients. Other restrictions are also in place as PEI now operates under a public health emergency. All the while, small businesses and their employees wonder how they can survive the global pandemic and a massive economic slowdown. Good evening. Thank you for joining us on Compass tonight. I'm Louise Martin. PEI is under new restrictions today in an effort to control the spread of COVID-19. They were announced this afternoon by PEI's Chief Public Health Officer.
Stay home if you can. I am encouraging Islanders strongly to stay home as much as possible. And that's whether or not you've, even without a travel history. Consider whether leaving the house is essential.
So here are the new closures and restrictions. There will be no more dining in restaurants. Delivery and pickup is still allowed if restaurants want to participate. Bars are closed until further notice. All indoor play areas closed, as well as movie theaters. And all non-essential government services are suspended for time being. Dental clinics will close for 2 weeks. Emergencies will be reviewed on a case-by-case basis. And wakes at funeral homes can be attended only by family with a maximum of 20 people. Health PEI is also advising anyone who was on WestJet flight 3440 from Toronto to Moncton on March 7th to now self-isolate. We now know the PEI woman who tested positive for COVID-19 was on that flight. That's this province's single confirmed case to date. So again, anyone that was on WestJet flight 3440 from Toronto to Moncton on March 7th should self-isolate. So lots of new developments today to tell you about, and our Wayne Thibodeau has been on this story and joins me now live with the very latest. So Wayne, that list of closures is quite substantial. What did Dr. Morrison have to say about all of that?
Well, Louise, as you said, another day of dramatic developments here, and Dr. Heather Morrison is more blunt than ever today. She said if you don't have to leave your house, you should not go. You should not be going shopping. You should not be going to visit friends. Now, she did say groceries are essential, and that's something that you do have to go out to do. Now, Dr. Morrison said you don't have to panic, but you do have to take this seriously.
We need to take this seriously, and I think your question is good because I'm not sure everyone on PEI understands that it's important to self-isolate, and it's important that you limit our contact with others. And I guess we're talking about social distancing. And if you're going out into crowded places that you do not need to be, that is not where we want Islanders.
Now, we should point out, Louise, that at this point in time, those new powers that the health minister was handed yesterday, those were powers that will allow her to be able to force people to stay home or close businesses. She hasn't had to use those powers yet, but she said if she has to, she will.
And I'm asking Islanders to help support each other in this very difficult time. And we need to think about different ways to do that other than in person. So it's calling more often, using our FaceTime, emails, still reaching out and supporting each other, but not in the ways we've been used to doing.
Yeah, you can certainly, Wayne, hear that change in Dr. Morrison's tone, can't you? That this needs to be taken really, really seriously, and you have to sort of abide by these rules or recommendations. So far, we know that there's still one confirmed case on PEI, but certainly more expected at some point. What do you know about the hospitals, staffing available to handle people who might get sick?
Yeah, that's right, Louise. We can say at this point still just one confirmed case. There's 40 negative cases, so that at this point in time is a bit of good news, but we're still waiting on results from 106 test results at this point in time. We need to point out that all of these go to the National Biological Lab. That's in Winnipeg, so it takes a few days. So we're going to have the weekend results by the end of the day today or first thing tomorrow morning. Now, the hospitals are already making room for the flood of patients that could come as a result of COVID-19. We all know our hospitals run at about 100% capacity. That basically means every hospital bed is full. The goal of Health PEI is to reduce that to about 75%. So that means about 25% of the patients who are currently in hospital will be found in new location. They will either be going into manors or hopefully back home until this all passes. Now, we should also note a number of islanders raising concerns about the 811 call system. They have been flooded with calls, and they're taking steps to address that. That 811 system is shared between the provinces of Nova Scotia and PEI. So they've hired an additional 29 nurses and 11 call takers to help ease the pressure.
And Wayne, I understand PEI Premier Dennis King, he held a series of virtual meetings today as we're doing more and more now, and he's coordinating the response from his home. So what can you tell us about those today?
Yeah, that's right. Premier Dennis King still in self-isolation until March 26th. That's when he's able to get out again amongst the rest of us. There was a news conference just moments ago where the Premier announced over $500,000 in aid in what the Premier described a way to help people feed their families. I know we'll have more on that in just a moment. He had a series of meetings today with community groups and organizations, including Maritime Electric, the Summerside Chamber of Commerce, and the early childhood educators. Lots of calls. The Premier, though, one of the most important calls he had was with officials from Sobeys, and he wanted to stress to Islanders that there is no need to panic shop. In a release by both Sobeys and the Premier, he said consumers need to remain calm and think of their needs and buy to these needs. Also, remember the greater community and only buy what you need. So again, just a reminder that no need to panic shop, that Sobeys, Superstore have all issued statements saying that there will be lots of product on the shelves.
And Wayne, I know the cities of Charlottetown, Summerside, they held news briefings today. What did they have to say? Yeah,
the big news from both cities, Charlottetown and Summerside, is basically all municipal buildings are closed. So in Charlottetown, City Hall, the fire station, the police station, all closed to the public. Now, essential services will still be there. Firefighters will still respond to calls, as will police. And police and fire officials are also taking steps to ensure that the first responders, those who have to respond to calls, are being protected.
Thank you for this live update tonight, Wayne. Lots to report on. Good job. Thank you. That's Wayne Thibodeau reporting live tonight for us. So as we said, there's lots of new information. Late this afternoon, the province announced new support measures. So Wayne touched on that briefly, that $500,000. So here's how that breaks down. People who are self-employed will get $500 a week. $500,000 is going to PEI food banks, the United Way, the Salvation Army, and community programs. The province has asked Maritime Electric to not disconnect power to anyone for the next 2 weeks. And any evictions of tenants living in public housing will be suspended for the next 6 weeks.
This is not the time to be evicting people because they can't pay their bills because of what's happened here in the last few weeks. So more on that in the next day ahead, but certainly we'll be talking to and send a message here to all landlords in this province to like all Islanders are doing in this difficult time, to try to make the best possible decisions that can be made, keeping in mind we're in these very, very unprecedented times.
So that was from the most recent government briefing that was just held at 5 o'clock, just after 5 o'clock. Government also did announce more closures today. A reminder that we are keeping track of all of those for you, some school issues as well. So you can visit our website at cbc.ca/PEI for the very latest updates and cancellations. And if you do need to report a closure, you can call our cancellation hotline. That number is 1-877-236-9350. So as we told you, dental clinics, will be closing for 2 weeks. A number of other health services on PEI also taking precautionary measures, including scaling back their practices. Isabella Zavarisi has that story.
Physiotherapists have been paying close attention to COVID-19. They want people to know that they are staying open, but only to help those most in need of their care. The PEI Physiotherapy Association is asking people who don't have an urgent need to postpone their appointments.
We have a huge role to play in flattening the curve. The association takes that extremely seriously. All members of the public need to take that seriously. So clients of clinics themselves have a role to play in calling ahead and making decisions for themselves about what they feel is essential and urgent.
Mackenzie says clinics are only looking to treat the most urgent cases. That means people who may be recovering from strokes, car accidents, or serious surgeries. It's a direction the PEI Chiropractic Association is also taking.
Somebody who's in urgent need, they should be seeking treatment. You know, if you're in severe pain, we don't want someone being in severe pain. But every clinic is having to evaluate that themselves.
The PEI College of Optometrists says it's triaging patients to gauge those healthy enough to come in. It's also asking that non-essential appointments like routine eye exams be cancelled, and says it's implementing precautions like breath shields and asking patients not to speak while optometrists examine them. These professions say the services they're providing are helping to take a strain off the healthcare system, which is why they're continuing to provide urgent care. In some cases, they say they may be able to provide online consultations, but they all agree this could change, depending on the direction of PEI's public health office. Isabella Zavarisi, CBC News, Charlottetown.
Well, businesses of all kinds are feeling this crisis. Hundreds so far have called that new number for business provided by the province. Our Brittany Spencer is on that for us tonight, live outside. Brittany.
That's right, Louise. Well, for some of the businesses that I talked to today, the restaurants rather, the news out of the Chief Public Health Office wasn't actually a surprise. Around noon today, Murphy's Hospitality Group, which is one of the largest restaurant operators here on the island, announced that its dining rooms would actually close at 5 o'clock today anyway, and it plans to lay off about 200 employees here on PEI.
Murphy Group says some restaurants will stay open to only offer takeout and pickup services, a move many other restaurants in Charlottetown are making as well. But for some, the evolving situation has forced them to shut down altogether. But it's not just restaurants that are feeling this. While there are still open signs flashing in some Charlottetown shop windows today, others are exploring other ways to serve customers. Some are reducing staff and offering pickup services so shoppers don't have to enter stores. Others, like PEI Cannabis and liquor stores, have stopped accepting cash payments, and some are closing down for the time being. Kinetic Fitness is one of them. After canceling group classes last week, owner Amila Topic says she decided staying open wasn't worth the risk.
A lot of my circle of friends are also small business owners, and that's sort of been the discussion is kind of what's next. But I guess my message now to other business owners is, we kind of have to put that financial worry aside and make the decision ultimately for the betterment of our community and the safety and wellness of our community.
Yesterday, the province announced a $25 million relief fund, and today announced a $500 weekly payment for self-employed islanders and loans of up to $100,000 for small businesses. There's also a 1-800 number to support employers as they try to figure out what to do next. But businesses I spoke to say they couldn't get through and are left with pressing questions, including what all of this will mean once tourist season arrives and what it'll mean for seasonal employees.
July and August for all of the seasonal businesses. July and August is tourist season. We need those tourists or we just can't survive. I'm just concerned about keeping my staff and so that they can earn enough money actually to get in enough hours to get next year's EI.
In a statement released today, the province said it's already received hundreds of calls. It has 6 lines open with 20 staff taking those calls, and it's asking islanders for their patience. Information gathered over the phone line will be used to figure out how the relief fund can help island businesses.
And Louise, I spoke to a couple other businesses that are looking for other ways they can try to help during this situation. One grocery store I talked to is looking at extending its hours to provide more time for seniors and people who might have compromised immune systems to get in there and do their shopping without the crowds.
Thank you, Brittany, so much to digest today. I appreciate your help by guiding us through that. That is Brittany Spencer reporting for us live tonight. Even while so many things in our province are shutting down, some people still, of course, have to get around. So transit, taxis, and other public transportation workers are taking extra steps to contain the spread of the virus. Tony Davis has that part of the story.
E3 Transit and Maritime Bus have ramped up their cleaning. Drivers are sanitizing surfaces about 7 times a day, and just a couple of hours ago, new rules. Buses need to reduce capacity by half. But earlier today, efforts were already underway.
Now there is no standing room allowed in a bus. We are trying our best. The first 3 seats are being pulled up so nobody can sit next to the door, next to the driver. And we are saying that only the seats that are on the bus are to be used without standing room.
But Charlottetown Mayor Philip Brown says if you are sick, don't use public transit. Taxi drivers on PEI are also cleaning more, wiping down cars between customers. It is single fare only at Yellow Cab. Drivers are not picking up multiple people anymore.
We have some wipes in the car. We're wiping down the door handles when they get out, our debit machines and stuff like that, but business is kind of a little slow.
Pat and the Elephant offers transportation for Islanders with disabilities. The company is also doing extra cleaning.
Lysol rags, which are the hardest things to come by these days, by the way. We're using those to clean all of the equipment and stuff in and around the clients after they use them, so between clients. So it's a bit of a step up. It's normal operating procedure. Normally is what we do, but we're being a little more diligent with it now.
It's slower than normal. Pat and the Elephant usually does about 100 drives a day. Tomorrow, they only have 15 booked. Yellow Cab also says business is slow, especially with the Charlottetown Airport having fewer flights. Straight Crossing also announced today that the Confederation Bridge pedestrian shuttle will be shut down midnight Thursday. Tony Davis, CBC News, Charlottetown.
If you have any questions at all, PEI has set up an information line, so that is toll-free. The number there, 1-800-958-6400. You can leave a message there and someone will return your call from the Chief Public Health Office. Much more still to come on Compass tonight before 7 o'clock. Coming up, Health PEI's Chief Nursing Officer will join me with more details on today's announcement regarding essential services within Health PEI. What does that mean? We'll speak with the Canadian Federation of Independent Business on small business concerns during this global pandemic. And then later, the latest on national efforts to contain the spread of COVID-19. The Prime Minister once again spoke today from his self-isolation. We're back with all of this coming up. Weather with Jay Scotland. He is back. That is next as we go to break and a look outside on this Tuesday night. We're back just over 3 minutes time. All right, it is time for weather now, and you'll notice that Jay and I are following the rules. We are social distancing.
We're in digital boxes on your screen.
We're over 2 meters apart, as per the recommendations by the province and the federal government. And you'll notice, too, our interviews tonight are being conducted by Skype or FaceTime, just to sort of, you know, keep that message driving home the recommendations there. But the weather is here, live tonight with Jay Scotland, back in the house, and we're happy to have you back, Jay. And what can you tell us? What's happening?
Happy to be back. And I will say, being apart is because we care about each other as well. Even though it may look odd to not see us on the news desk together tonight, we are here just a few meters apart in studio. All right, let's talk about the weather. Take our minds off all of the other news for just a few moments anyway. And the good news in terms of the weather is we are heading out of our winter storm season. The next round of active weather typically comes as we get into the late summer and more so into early fall with the hurricane season. That is months and months away, so some quieter weather over the coming months. Just have the next couple of weeks to get through, and then that risk of winter storms will be done. +1 at the moment in Charlottetown as we zoom in to take a look at temperatures across the island. Sitting between -1 and +1 this hour. We do have some wet snow that is moving in. Could see some accumulating snow this evening to go along with some pretty brisk winds. They have been picking up, generally out of the south between 20 and 40 kilometers per hour. Could see gusts as high as 60 this evening. They'll ease a little bit through the overnight hours tonight, and they'll pick up again early tomorrow morning. So that would mean there is the risk of some blowing snow and reduced visibility tonight. We are watching for that steadier snow to continue to build in. As I take a wider look at our satellite and radar imagery, you can see that steadier snow back into New Brunswick at the moment, just a few hours out from seeing that starting to accumulate here on PEI. It's not going to amount to too much, anywhere from 2 centimeters to maybe as much as 5 centimeters, and there could be a little bit of missing as we get towards midnight. Some warmer air will start to build in. It will still be below freezing at the surface in most areas, so some patchy freezing rain could be possible at times. That area of low pressure, though, pretty fast mover. As we get past midnight tonight, you'll already see the flurries tapering off up west, and then that system will track further to our north and east, and it does clear out before morning tomorrow. We'll actually start out pretty sunny in the morning. Big blue H on the weather map means not much to talk about in terms of weather. Some brisk winds, but aside from some brisk winds, we will be looking at lots of sunshine tomorrow and fairly mild temperatures between -1 and +1. So it's going to be a nice one tomorrow if you want to do those outdoor activities. That's another great way to practice social distancing, spending a lot of time, maybe doing some walks, heading up to the shore, seeing the beach, some trail hikes. It's going to be a lovely one aside from a brisk westerly wind tomorrow. So after that snow tonight, after midnight, it will begin to taper off over the course of a few hours. I think shortly after midnight up west, a little bit longer for areas east, and lots of sunshine and temperatures around the freezing mark tomorrow. Winds will be a little bit gusty, particularly through the first half of the day, though. Central eastern PEI, similar story with some snow, maybe mixing with some patchy freezing rain just around midnight, but clearing out in time for lots of sunshine tomorrow. So a bit breezy. Could be a bit windier in the morning. Still some gusts near 60 possible in the morning. But we will be looking at those mild temperatures sticking around through Friday. Windy, rainy, but a high of 7 degrees. And then there's a look at that long-range forecast. Still some cooler days as we take a look at the next 7. Here's a quick look at your national temperatures now across the country. And now we'll take a look at our photo of the day. Michael Huang sending in this one. This is one of my favorite spots. Actually, we were just here on Sunday. We took a walk up along the North Shore at Cove Head. That is, of course, the lighthouse at Cove Head. It looks like a toque onto one of the on one of the fence posts there. Thank you so much for sharing that photo. Michael, get us your photos, compass@cbc.ca. The best way to do that is by email. You can always share them through social media as well. Nice to know that that toque is keeping that post warm.
All right, thanks, Jay, and we'll be right back on Compass. Stay with us.
Wednesday on Island Morning, a phone-in. We are opening phone lines after 7 a.m., and you will have an opportunity to ask your COVID-related health questions to Dr. Iris Gorfinkel. Our studio lines will be open after 7 a.m. tomorrow. That's on 96.1 FM.
More of your questions now on PEI's readiness for COVID-19. We heard some more of those measures being taken today from Dr. Heather Morrison, as you heard earlier. And I'm joined now via FaceTime by Marion Dowling, Health PEI's Chief Nursing Officer. Nice to see you again.
Hi, nice to see you, Louise.
So Health PEI, you announced today, has implemented its Essential Services Plan. Can you go through what that means exactly?
It involves moving toward emergency care services, which will be maintained. But patients who are less sick are being asked to book with those community-based appointments in order to maintain our emergency department capacity. We're looking at our inpatient care areas where patients are being prioritized that can be moved to long-term care for placement that may have been waiting and where beds are now available in long-term care facilities. So they'll be moved as safely as they can to create some capacity within our long-term care facilities. Long-term care itself is also maximizing their ability and looking at ways that they will be able to care for their residents in their home in order to avoid admission or transfer to hospital.
When you talk about moving patients, so as I understand it, is it out of all hospitals? I think earlier you said the number 25% trying to move them out of hospitals and into long-term care. Is that correct?
Not just for long-term care. We're trying to create about 25% capacity across all of our hospitals.
Okay, so that's in all hospitals, not just QEH.
That's right. No, not just QEH. It's being coordinated provincially with a lens to create that capacity within our acute care sector. And it's important to know it's not just residents moving to long-term care or individuals waiting for long-term care that will be discharging from hospital. It'll also be those others who can safely be discharged home, as well as just the move to essential services, in particular with surgeries. We'll only be doing those essential or emergency surgeries, so other elective cases that are procedures that would have been coming in and requiring an inpatient stay will no longer occupy those inpatient beds as well. So that will give us some capacity also.
What about visitor restrictions in place at any of the hospitals? Is that the case now?
Yes, it is. We have implemented visitor restrictions, complete restrictions for visitors in our long-term care facilities. And that is, of course, to reduce the risk for that most vulnerable population with this COVID-19 virus. For other areas of care, we have very limited visiting. And so we're looking at a maximum of 2 people with any of our inpatient areas that are designated visitors. And they must not be people who have been sick or who have symptoms or should be home self-isolating. So we're trying to take real care and caution when we're allowing people in to these areas where we have sick patients. We will be looking for some exceptions if we can at all, as long as people are not exhibiting symptoms or are not well, that they would be able to have some exceptions in the case of end of life or even in birth situations. So we are looking at all those opportunities to try and work with families to make it as safe as possible, but we do have those restrictions in place.
As far as staffing goes, what about any nurses or doctors who are unable to work right now because of self-isolation?
Yes, I don't have the numbers for you today, but we do have an impact across the system with various healthcare providers. So not just doctors and nurses, but other staff that are very important to our services as well, that have been impacted by the public health restrictions of self-isolation if they've been traveling. And it is important to just say all of our staff are required to comply with those recommendations through the Chief Public Health Office. So we're adapting to that, and this move to essential services gives us some capacity to manage that as well as making sure staff have some training and the time to review our protocols around isolation and procedures if we receive influenza or COVID-19 patients into our facilities, that they have the time to be making themselves very aware and comfortable with the protocols that we have in place.
What about retirees? Have you had anyone come forward to offer to sort of come out of retirement to help alleviate some of the need?
We have, our Human Resources Department is leading that plan, and they've reached out to a number of the professional colleges and regulatory bodies on the island. And I know as of this morning, they had a number of, in particular, registered nurses who had expressed an interest in being willing to come back and working with the college around the ability to get those retirees relicensed and registered with our college so that they can help join our workforce and we can use them as needed.
What about equipment? You and I have spoken about this before, but just maybe we can do an update for those at home wondering. Shortage of ventilators.
Yeah, we don't have a shortage at the moment, but we have a finite number of resources in that regard with across our facilities. And two main facilities, the Queen Elizabeth Hospital and Prince County Hospital, are where we have our ventilators. I can give you some of the numbers. We have 15 at the QEH right now, and there are 4 at Prince County Hospital that are available and ready to use. In addition to that, we have some other machines within our operating room at the QEH that can be converted to do some short-term ventilation and some other breathing support devices that we can also look to. But it is important to say that at the federal level and provincially, our Chief Public Health Office has linked us with those provincial committees that are looking at these logistics and supply chain issues, and we have put forward a request for a number of additional ventilators through that process. So we don't certainly expect them next week, but they have our ask as well to look for additional resources in case they are to be needed.
Just a quick question about walk-in clinics. Are there any restrictions there or any being planned?
We are working with all primary care providers to provide them with some opportunity to do care virtually if it's safe and available over the telephone. So physicians and nurse practitioners can actually provide updates and renew prescriptions and some of those things with some of the patients they know over the phone. And otherwise, I don't have an update on the exact hours for the walk-in clinics, but I'm not aware of restrictions at the moment.
Okay, I appreciate so much your time tonight. Thank you.
You're welcome.
Still ahead, small businesses, of course, worried about the impact of COVID-19. The Canadian Federation of Independent Business says half of Canada's small firms have already seen a drop in sales, and it's only going to get worse. That's next on Compass. Small business owners and their employees are worried. Concerns about the short-term and long-term impact the COVID-19 pandemic will have on them. The Canadian Federation of Independent Business is urging small business owners to heed the advice of public health officials while recognizing the massive economic consequences of things like self-isolation and social distancing. The CF IB's Louis-Philippe Gauthier joins me tonight via Skype from Moncton. Nice to see you, sir. You recently conducted an online survey. What were the key findings?
Well, essentially, our members have been telling us through that research over the last 3 days that the impacts are real. Their sales revenue is, in certain cases, going down. The major finding that we received from our members is for 25% of our small businesses, they're indicating that if this goes on for more than a month and their sales are impacted at more than 50%, that they will not be able to stay in business. So it is very concerning.
So it is a very real possibility at this point that we could see a number of small businesses having to close their doors indefinitely?
Well, they're saying they have the cash reserves for a month if they are hit with more than 50% in reduction in business. The reality is small businesses are getting hit from all sides. Our new reality. The revenues are going down for a lot of businesses that are public facing. So for any business that has to directly transact with a customer and that the customers are just not there, money stops going in. And for 25% of our members, they're saying, I'm going to be able to keep doors open for a month. After that, I'm going to have to make a serious decision. So from that perspective, it's very concerning. That's why we're asking the federal government and the governments overall to do everything that they can to consider that reality. The action needs to be broad and the action needs to be swift.
I'll ask you more specifically about what you mean there, but I just wanted to ask your opinion on just, we know the country is vulnerable, but how vulnerable is PEI?
Well, PEI, as you know, has a large sector relating to tourism. At this point, these are all customer facing. These are all businesses that count on people going to the island and enjoying all that it has. At this point, today, Prime Minister Trudeau indicated that the Canadians would probably soon find every door closed. So that just basically means these businesses will not be receiving any revenue. And the research clearly tells us that the impact is going to be there and that the breathing room that certain businesses have is no more than a month.
Yeah, we just heard today from our public health office that bars immediately closed, in-room dining, just takeout only for restaurants. And those are obviously measures that are happening right across the country. But we have heard some financial measures from the federal government. PEI government announced an emergency contingency fund. How much will this help and what other measures should be in place?
Well, it'll help. The reality is there needs to be additional measures from the federal government. We're hopeful that tomorrow they will announce more. As you know, this is changing every single day for government, for businesses, for people, and that's a reality. The announcement of the funds that was done by the PEI government is more than welcome, and that's every little bit that can be done will help. The thing that people need to understand as they stay home, you're not there, you're not consuming. And if there is any opportunity for you to reach out to a small business and help them by, is it possible to have whatever that I need delivered at my house, or encouraging and buying from small businesses at this time is very important. Fortunately, there's still a lot of businesses that count on being in touch with the customer. And when that's not possible, well, there is no business activity.
All right. I really appreciate your time tonight. Thank you so much for joining us.
My pleasure.
Coming up, the latest in our series that brings you the stories of immigrants now living on PEI. So tonight you're going to learn about Shukri Muhammad from Somalia. Her story is just ahead. Today, the Prime Minister and other authorities were driving home the seriousness of the situation and trying to control the damage with increased efforts to stop the spread of COVID-19. Julie Van Dusen reports for us tonight.
If you were wondering just how long this COVID-19 virus will last, it's impossible to say.
We don't know exactly how long this is going to take, whether it takes weeks or months, but we know that every step of the way, we will be there to support each other.
What is certain, restrictions on the lives of Canadians will increase. Tomorrow, all federal parks will shutter, adding to the list of places that are out of bounds.
The physical installation of Parks Canada will no longer be open. Parks Canada will no longer admit visitors.
Thankfully, grocery stores are open, and that's one of the reasons the border with the U.S. wasn't closed, says Deputy Prime Minister Chrystia Freeland.
We get our groceries thanks to truckers who drive back and forth across that border.
Doctors, nurses, and medical professionals are on the job. The Prime Minister urged Canadians to stay healthy and not to add to their burden.
Stay home. Don't go out unless you absolutely have to.
It is St. Patrick's Day today, but we have to practice social distancing.
It's unprecedented that on this St. Patrick's Day, celebrations won't be happening as in years past. Canada's health minister broke down as she urged Canadians to be kind in this stressful time.
Check in with vulnerable people by phone. Think of ways you can help to ensure that we get through this together.
Meanwhile, there are up to 3 million Canadians who work or are traveling abroad. Already thousands have come home. The government is offering loans of up to $5,000 to those who need financial help with travel or living expenses. No matter what, some Canadians will simply be stranded as borders close and flights are cancelled.
There are some of them who will not be coming home in the coming weeks.
The government will announce other measures tomorrow to help people financially. It's also been in very preliminary talks with the provinces about the Emergency Measures Act, which used to be called the War Measures Act and could be used to control the movement of people and goods. Julie Van Dusen, CBC News, Ottawa.
So now 3 provincial governments have announced various levels of states of emergency in the fight against COVID-19. Yesterday, as you know, PI declared a public health emergency, and today both Alberta and Ontario made their own declarations.
We're facing an unprecedented time in our history. This is a decision that was not made lightly. COVID-19 constitutes a danger of major proportions. We're taking this measure because we must offer our full support and every power possible to help our healthcare sector fight the spread of COVID-19.
Ontario is reporting 190 cases of COVID-19. That is the highest in the country. There's been 1 death in that province linked to the virus. The state of emergency closes most public facilities and limits public gatherings. Along with the 3 provinces, several cities across the country are putting their own emergency measures in place. The World Health Organization says fighting the coronavirus requires social distancing and testing, and it's calling on health authorities and governments around the world to step up that effort.
This is the defining global health crisis of our time. The days, weeks, and months ahead will be a test of our resolve, a test of our trust in science, and a test of solidarity. Crises like this tend to bring out the best and worst in humanity. This is everybody's responsibility.
People are scared, and that's normal. What we need to make sure that people have is reliable information about what is this virus, how does it spread, how do we protect ourselves and our loved ones.
Although we may have to be physically apart from each other for a while, we can come together in ways we never have before. We're all in this together, and we can only succeed together.
And you may have seen a lot of misleading or just plain false information about COVID-19. Our colleague Lorenda Redekop helps debunk some of the latest claims coursing through social networks.
The advice about COVID-19 is popping up all over online.
If you can hold your breath for 10 seconds, you're safe and don't have the virus. There's already an all-natural coronavirus vaccine, and it works. We took some claims to an expert. Colin Furness is an epidemiologist with the University of Toronto's Faculty of Information.
If you drink water every 15 minutes, you're going to wash it away.
Yeah, that doesn't make a lot of sense. In fact, if you thought there was COVID-19 in your throat, drinking water would push it into your body, into your intestines, where it actually might get a foothold.
What about eating garlic, that's going to help you?
That makes no sense. Garlic has antibacterial properties. This would have no impact on a virus.
What about that you really need a lot of bottled water for this?
Yeah, this is not a waterborne virus at all.
We are seeing, too, that maybe this virus doesn't survive in hot countries.
Viruses don't like heat, and we don't know exactly what kind of threshold. If I cough on you inside, it doesn't matter what the weather is.
Social media and technology companies are trying to fight this. Google searches about the virus now trigger an SOS alert and bring up information from mainstream trusted sources first. You might see this on a Facebook post. The social media platform is attempting to limit misinformation and harmful content. It's also prohibiting some ads while offering ad to the WHO for free. Furness says it's important for officials who inform the public to keep it simple.
Piling on more information, even if it's great information, is actually not going to help people right now who really need it the most. People are panicking who cannot process that.
For everybody else, he says pay attention to the source of the information. Lorenta Redicomp, CBC News, Toronto.
And now, a welcome change of focus as we continue our series, I Live Here Now. We're profiling immigrants who've chosen to come to PEI, many for work or education, and some, like Shukri Mohammed, for safety. Here's her story.
All my life, I was refugee. I am not refugee now, because Canadian people are good people. If you need help, they help you. And if you need something, everything they can help you.
Nice to meet you. Thank you.
Hi, my name is Shukri Mohammed. I am from Somalia. I live here now. I like my family, but I don't like Somalia.
The pieces are in place: drought, rising food costs, and warfare. The UN is now feeding 77% more Somalis than it was at the start of the year.
I was with my family, I live with them, and we were in Somalia. Then my mom said to me, go to the supermarket and buy us something. And I go to the supermarket to buy some food. Some guys came in our home and they took my mom and my father and my brothers and my sisters. They took all of them. When I back the supermarket, I didn't see with my family. I was refugee in Egypt 10 years, so the United Nations helped me to come here. That is the reason that I didn't see my family 11 years. Yes, I miss them, and I hope to see them be here. I wanted to come with my family in Canada to have a good life.
You're used to me now.
I'm very happy to live in BEI. When I was in BEI 2 months, I got a job. No, I don't want someone helping me because I can walk. If I am sick, yes, it is possible to help me. But if you are not sick and you are young, you must walk. I work from Monday to Friday, and I go to school 2 evening, Tuesday and Thursday evening. On Sunday, I work housekeeping. I am looking for part-time evening job because if I work more, I will come, I am tired and I slept. So I don't want to be stressed and I don't want to remember with my family. That is why. I wanted to help my father and my mother in Somalia, and also I wanted to sponsor my sister. I wanted to learn the language, and if it's possible also to go to university if I finish the language. I also wanted to buy the car next summer if it is possible. stay now 1 year. If I finish 3 years, I got citizen.
That's a beautiful smile there. We should mention you saw a busy classroom in that story. That this profile was actually shot back in early January. You can read more of Shukri's story on our website about what became of her family in Somalia and her plans for the future here on PEI. That is on our website, cbc.ca/PEI. And here's a look at how the markets performed today. A little bit of positivity injected today, still not enough to erase the deep losses we've seen, but the Canadian dollar inching closer to 70 cents US. We did see the TSX gain 324 points, the Dow climbing over 1,000 points by the closing bell. Take a look at the price of oil, which is down again today, $1.75 lower, and the price of gold, $39.30 US an ounce higher. Time for our last look at the weather forecast now, and maybe a few flurries. Is that accurate, Jay?
Yeah, I would say that. Might add up to a few to 5 centimeters, but not much. It could be worse, is what I'm saying. 2 to 5 centimeters of snow, most of that falling this evening. Once we get past midnight, could be mixing with a little bit of freezing rain. It'll be patchy. It's not going to amount to too much. And then it does taper off and clear out long before morning. So the good news for tomorrow, it is going to be a quiet weather day. We will start out, well, sun doesn't rise until 7:18 tomorrow morning. So it'll be still daylight at 7 a.m. But we'll just look at a few clouds in the sky. North to northwest winds be quite brisk, though, 30 to 60 kilometers per hour. As we head into the noon hour, lots of sunshine. Temperatures will be up between -1 and +1 at their warmest tomorrow, which is not bad for this time of year. Winds will remain brisk, though, 30 to 50 k out of the northwest for the noon hour, and still in the 30 to 40 k range, but easing as we get into the late afternoon. Lots of sunshine, temperatures near freezing aside from those brisk winds. Pretty nice day to get out and enjoy some outdoor time tomorrow. Louise?
All right, thanks so much, Jay. And thank you for joining us tonight. We're in digital boxes, social distancing, being good citizens. See you tomorrow. Good night, PEI.